Good evening. My name is Andres Mantilla. I am the Director of the Department of Neighborhoods at the City of Seattle. Welcome and thank you all for joining today. This town hall is a collaboration with the mayor as well as various departments within the City of Seattle to bring you the most current information available. I know that we are all eager to hear your questions related to the COVID-19 pandemic as well as issues around policing and the budget. We want to hear your thoughts and concerns about how we can work together to build a safe and healthy Seattle. Today you will be hearing from Mayor Jenny Durkan, then Chief Best, then Patty Hayes, the Director of Public Health, Seattle-King County, our Seattle Fire Chief, Harold Scoggins, and then Seattle Human Service Director, Jason Johnson. Each director will give a short presentation and we will have a moderated Q&A at the end with all speakers. For any media attending, if you would like to ask questions, please reach out to the Mayor's Office communication staff. For residents and community members that would like to ask questions, please type in any questions that you have into the chat feature, and we will do our best to accommodate as many questions as we can. A lot of the times these questions come in and we'll try to group them in by topic. I would also like to take this time to remind you about the Mayor's COVID-19 resource page. This is a great resource for finding all the latest updates from the city. So please visit COVID-19 resource page at seattle.gov/mayor/COVID-19. And we'll put that in the chat feature as well. Now I'm going to go ahead and pass it over to Mayor Jenny Durkan to give some opening remarks. Mayor.
Thank you, Andres, and welcome to everybody this evening. I can say that I'm really sorry we're not doing this in person. As you know, one of the things I love to do is get out around town and have town halls, small meetings, and our life has changed. I know that this has been a difficult time on everyone in Seattle and every part of Seattle. Our city has faced three consequential challenges, any one of them which would have been an unprecedented challenge for a city, but taken together, they really have given us the most challenging times. The first, of course, was the COVID-19 pandemic. We were one of the first cities and areas to experience it, and we had absolutely no playbook and having to work across our departments with the city, with the county, with the state to try to build a better and healthy environment for everyone in Seattle. That pandemic has just had devastating consequences. It has changed how we do business, how we communicate with each other, how often we see friends or family, how we grocery shop. There's almost no part of our life that hasn't been touched by this pandemic. And unfortunately, after doing so well in Seattle and flattening the curve, once we started opening businesses, we've seen that there's been an uptick in the number of infections. And we now see as many infections in the recent weeks as we saw at the end of March, beginning of April period. So we're very concerned at the city level and the county level and the state level, and talk regularly with the governor and King County Executive Dow Constantine, as well as the public health officials, to really chart a course to make sure that we do all we can to keep Seattle safe. And so I want to thank everybody who's done their part. I want to thank all the essential workers who go to work every day. Please wear a mask. If you kind of let up on your social gathering, you shouldn't be gathering in large groups. The only way this virus can transmit each other is from person to person. So no large gatherings, wash your hands, mask up. If you're vulnerable or live with someone who is, please take extra precautions. With COVID has come just devastating economic impacts. And those impacts have really hurt workers and small businesses. We have seen untold hundreds of businesses close and literally tens of thousands of Seattleites who are out of work. We know that August 1st is coming, and with that, people's rent or mortgage are due, and this is going to be a very stressful period for so many in Seattle, particularly because Congress has failed to act, and we don't know whether benefits from unemployment will continue at the same level, putting more strains on families. We've worked really hard at the city during the COVID crisis to both keep people healthier, and I'm glad Chief Scoggins is here to talk about some of the things the fire department's done. We've worked closely with public health to make sure we're taking what precautions we need, not just as an employer in the city of Seattle, but as the people who really provide you their services. The economic impacts came quick and they came deep. And we've really tried to change how the city does business so that we now deliver hot meals to seniors and grocery vouchers to thousands of families in Seattle. We've worked with outside philanthropy and businesses to create programs for rental assistance and assistance for restaurant workers. I'm proud of All in Washington and All in Seattle and the level of commitment, but we know it's not enough. And then if these two things weren't enough, we're in the middle of a civil rights reckoning for our city, our state, and our country. And it has raised really significant concerns about policing and other systemic racism in all our government systems. And it's called on us to really reimagine, what is a healthy community look like? And how do we as a city invest in the Black community and communities of color to make them more healthy, to acknowledge the role that systemic racism has played in our city and our country? I've promised $100 million of investments in those communities so that we can invest things like childcare and preschool, affordable housing and economic opportunity. If we do those things and we do it at scale, we'll have healthier communities, and healthier communities are safer communities. At the same time, I'm so proud to be working with Chief Best, who you're going to hear from, to really be leading a conversation on how do we reimagine policing in Seattle going forward. What are those roles that only traditional police can do? And what are some of the roles that others might do, like social workers or mental health workers? Chief Scoggins will tell you about Health One, a program we started that really got to that. Instead of police going to an incident that involves someone who was in crisis, we now have a program where a social worker and a trained medic go to give the person what they need. We want to have a system in place so that when someone calls 911, they get the help they need 24/7 in every part of our city. But that will not happen overnight. We have to build up that kind of capacity. We have to have communications with community to see and imagine what that looks like. And then we need to put it in place so that it truly is a new system of justice. Chief Best and I have made very clear that while we have looked at the budget for the Seattle Police Department and are looking at new ways to do business and how we reimagine policing, we also will not cut the budget so that it compromises the public safety of any part of our city. All of these jobs, all of this work, the global health pandemic, our economic downturn, and the civil rights uprising in our country have been made so much more difficult in our city and so many cities because of the federal administration and the president. We did not get the help we need and still don't get the help we need on the front for COVID. We're still struggling to get enough testing in the city of Seattle so that we can watch how this virus grows. We know that the economic resources have not continued like they need to continue for low-wage workers and small businesses in particular. And we know that with regards to civil rights, the federal administration and this president, instead of listening to the deep needs of community, instead has been sowing divisions in cities like ours in Portland. I hope we can move through all of this. I believe we can. I think we're a city that has what it needs to really lead the nation to show how we come through these crises. We will come through changed. We will be a different city how we come out, and the decisions we make today and tomorrow really will determine what this city is like for future generations. I know we've got a lot of work to do. I know you have questions. I look forward to answering them today and into the future. And with that, I'll now turn it over to Chief Best. Thank you so much.
Andres, are we ready?
Yeah, go ahead, Chief.
All right, thank you. Good afternoon, everyone. And of course, thank you, Mayor, for hosting this town hall and providing us the opportunity to reach out and to connect with our various community members across the city. Last week, I did a neighborhood walk in Ballard to check in with the community. And I will try to continue these walks to take advantage of this amazing weather for one, but I also hope to schedule others in North Seattle. I've been trying to meet with community members in small groups, socially distanced, of course, engaging in these virtual meetings as often as I can. As we all know, the challenges and the effects of COVID-19 has had on our region, our city, and our county have been very extensive. So before I give an update on what happened this past weekend, I want to focus first on some of your precinct's issues and concerns. First, as I hope most of you know, you will soon be getting a new North Precinct captain, Brian Stamfel. I know the community has had a great connection with Captain Eric Sano, and he's done a lot of really good work there. Reassigning officers, captains, and command staff to different areas happens routinely. It's a practice we engage in to make sure that people have different opportunities to learn about different areas of the city and to move on for their own career development, and also to get different eyes and a different set of perspective on issues that we're dealing with. Captain Stanfield is awesome. He comes from the West Precinct. He has experience and connection to the city, and he's going to build on Captain Sano's great work. And Captain Sano will be moving on to the East Precinct, where he worked before as a lieutenant. And at one point, I think I worked for him when I was a sergeant. So I think he's going to do a great job there as well. Second, please know that we are well aware of all the criminal behavior at the Everspring Inn and Motel on Aurora. With the extensive criminal data we've pulled over the last year for the motel, we have declared the property a chronic nuisance last week. If the nuisance is not abated, Seattle police will take legal action if needed. Third, the full council is expected to vote on August 3rd on SPD's remaining budget for this year. We have pointed out the operational realities of our budget and our staffing. It seems that we will not have this drastic cut in 2020 that we thought we might have, but we're not certain about what the future holds in that regard. And we don't know what 2021 holds. I have my team working constantly trying to figure out how we can deal with a variety of budget scenarios to move forward and to ensure that we are providing efficient public safety. My commitment is to put the abundance of our resources towards 911 response to calls. We have to maintain our ability to quickly get to in-progress crimes, especially when they involve life safety. We are actively participating in the initial conversations around what other types of calls we don't have to respond to necessarily, but we don't want to cut the officers off first without having a full plan in place to move forward for public safety. And lastly, as I promised, to talk about what happened last weekend. On Saturday, there was a large demonstration that began peacefully. Unfortunately, a large group involved in the demonstration turned violent and committed arson and property destruction, looting. They tossed projectiles. Some of them were on fire and other things that were thrown at officers. And they also used an explosive device to blow a hole in the wall of the East Precinct. In the end, we had 59 officers that were injured. 2 required additional treatment at Harborview Medical Center. And yes, some individuals in the crowd were hurt as well, which is something we just don't ever want to see. But it is my responsibility under the city's charter to keep people and property safe as we possibly can. And this demonstration clearly became a riot before SPD could engage the crowd. So, we're going to continue to work with community members, with people who want to effectively express their First Amendment free speech. We encourage civic action and civic duty in the city, but we just have to draw the line when it becomes a situation where there's extensive life safety issues and property damage. And on another note, I know the pain all too well that some people are feeling about some of the issues that we're dealing with nationally and locally. Systemic racism has an ugly hold on many aspects of American life, whether it's in healthcare or education, public service, or public safety. With the murder of George Floyd and the death of Breonna Taylor, they leave people like me up at night thinking about some of the horrific things that can happen and things that can happen to people. We don't want people to get hurt no matter who they are or what the color of their skin is. And I know that we're going to continue to work hard in that vein. When it comes to the officers in our department, they come from every walk of life, every experience imaginable. Their parents, their children, their spouses, their partners, and community leaders and immigrants to this country. Many of these people have been inspired by seeing others treated unjustly, and they've dedicated themselves to making a difference, and they are determined to help. I want to change things for the better. I want to make sure that things in the city are going as they should be, and that we have comprehensive public safety, where all of us are partnering together to make sure that we are doing what's right in this city. Some of that may occur through protest, peaceful protests where people don't get hurt. But change can also come from conversation. And I want everyone to know that broad conversations are happening around re-envisioning and reimagining public safety and community safety. And I and the entire Seattle Police Department are committed to meaningful, community-led conversations and how we might work through some of these areas. It's not a new concept. Communication's been around for a long time, but we have to make sure that we're allowing the space and the opportunity for community, for officers, for other people to get involved so that we can ensure the public safety of everyone who lives here, who works here, and who visits here in Seattle. If we can make our systems better, and if they're better supported and managed, we will have less to do. So we're all for having less to do in the betterment of public safety. So today and moving forward, I'm looking forward to hearing from you and to answering any questions that you might have. Community safety involves all of us. We're all in this together. Thank you for this time.
Thank you, Chief. I'm going to turn it over to Director Patty Hayes. Patty.
Thank you so much. And it's a real pleasure to be with all of you tonight and to talk about the pandemic and the status of it. So as you see, there is a slide that talks about where we stand right now in King County. And let me start by just stepping back just for a minute and talking about what makes a pandemic different than other types, because there has been early on some discussion of, isn't this kind of like the flu? And as we've learned over the last 5 months, 6 months, that is absolutely not true. The coronavirus is different from other types of infections in 3 ways. And it's a pandemic because, number one, it's what's called a novel or new virus. In other words, what that means is that none of us have experienced it. So we do not have any type of way to either prevent it or to defend against it naturally in our bodies. So it makes a vulnerability that depends upon a lot of different things, as we're finding out with coronavirus, but that's the first thing. Secondly, there is no known absolute treatment. Now, luckily, our scientists have been working very hard the last 5 months, and we have some promising treatments and changes that have been made since King County became the epicenter in late February, early March with the Life Care Center nursing home outbreak. But we are still in the middle of research. And as I like to say, this is really science in action. We're learning about this virus real time, and that we are developing approaches to it real time. Thirdly, there's no vaccine. And there's been a lot of talk in the news about a vaccine potentially coming next year. And I hope that that is true. I hope we can have a vaccine available so that we can all look to getting back to normal. But one of the messages I want to start, as well as I'll end with it here, is that right now our best way of dealing with the virus and preventing the spread and death is that we must follow the community strategies. That includes physically distancing yourself by 6 feet from people. It includes wearing a face covering. It includes frequent hand hygiene and the use of a hand sanitizer if you can't wash your hands. And it includes staying home if you're not well. Those are key strategies that will be the only way that we can absolutely begin to control this. So with that said, what I want to report to you tonight is that since the time when we started opening up the economy, when we were allowing some restaurants to begin operation and people began, in some cases, to go back to work and gatherings started to happening, we have seen a quadrupling of the cases of COVID-19. In front of you are the metrics that we have to have reported to the governor under his order. And if you look at the bottom right of the slide, you'll see the website for King County, our dashboards. I would encourage you to look at these dashboards. There's a number of different dashboards up there. We have the metrics. We have one that shows the daily rate. It can be very informative for you, and there's a map that you can see the area around Seattle and look very specifically about where the outbreak is going in King County. But right now, we're not meeting the targets for where we know that we can control the outbreak. The most common areas that we're seeing of exposures are truly from gatherings in the community. It's from folks who are meeting and having barbecues out together. It is when people are going and having events together. It is happening in some employment settings where workers come together and are not physically distancing and wearing masks. It's so widespread right now that we actually, as we're doing our contact investigations and contact tracing, we're not able to identify for somebody exactly where that transmission, where they got the COVID, because when we talk with them, they say, well, this day I went and I was at an event down at the park. Well, this day I was at a backyard barbecue with my neighborhood. I went to church this day. Oh, I went to this other event. I ate at a restaurant. So because there's so many places that people are potentially exposing themselves, I want to just be really clear that that really risks individuals. And we know that the majority of the cases are now in folks who are between the ages of 20 and 40. They don't seem to experience as many adverse symptoms. They don't seem to end up in the hospital as much as other folks, but that doesn't mean that they don't contract COVID and they don't spread it. We've seen in other states that young people spread it to folks in 40 and above, and then when folks who have chronic conditions or more elderly folks get COVID, it can be disastrous. And as we're seeing more and more reports that the recovery from COVID is very, very tough for a lot of people. So it's a very serious disease. The other thing we also see is that our Black, Indigenous, and people of color communities continue to experience disproportionate impacts. That's because many of these communities are essential workers. They need to be at work. They're a very important part of our community. They also often have the living situations where they're in closer contact. So we're in particular looking at how to support that. We are hiring community health workers and navigators to help those communities be able to know what they need to do and be successful at that so that we can keep the outbreak under control in their communities. We have a very strong focus on testing, and we've been working with the City of Seattle, who's been a fantastic partner. You will hear from Chief Scoggins about the work on testing that's been done. You've seen from around the country that in certain areas there's been long lines with testing. We have tried not to have that here in King County. We are trying to open sites in a way that makes it easy for folks, as well as placed where we know that there may not be as big an access for tests. So we're continuing to work on that and expand as needed. But in addition to that, one of the key strategies is to do case investigation and contact tracing. We've hired over 40 different individuals who are working with us so that when we find that a case has been reported to us from a positive test, we follow up with that individual, we follow up with their family, and we follow up with the people that they have had contact with when they were in their infectious period. And we know that COVID can actually be transmitted up to 2 days before a person has symptoms. So it's very important when we work with individuals who have been diagnosed as having COVID to help them try and remember, where were they? It can be up to 2 weeks ago that they were exposed, and now they're showing COVID signs. They've tested positive, and we're talking with them, because we want both for themselves and for folks that have been exposed to isolate and to be successful, taking themselves away and not exposing other people. So we're working to support community so that they can do that successfully. But I'm also very concerned every day about the long-term effects on the community and well-being. I know how hard it is to keep the energy of the change we've seen, to stay home, to limit your outings, to limit your meeting with your friends and family, and to be in gatherings. This is going to affect us for a long time, and I need us all to work together. So in closing, I'd just like to say again that the most important thing I can ask you to do is to partner with me, to please, when you're out, limit your interactions, be in small groups, do distance yourself 6 feet from other people. Please wear a face covering. It can be one of the most important things you do that can protect your family, your grandmother, your church goers with you, and also to wash your hands frequently. And if you are not feeling well, whatever that may be, please stay home. So together we can fight this and we can get through this. It's just amazing to be in a place where a pandemic has not been experienced for over 100 years. We're learning every day, we're working together, and I appreciate everything that you do to make this successful. Thank you so much.
Thank you, Director Hayes. We're going to go to Chief Scoggins next. Chief.
Hello, good evening, everyone. I'll start off by saying wear your mask, wash your hands, and make sure you maintain physical distancing. I'll talk about 3 things this evening briefly. Our testing that we're doing here in the city of Seattle, the 911 calls that we are seeing fewer of since the pandemic began, and our Health One program. So on the first topic, Seattle citywide testing. What you're seeing in front of you is basically some bar graphs of our testing capacity and what we've been doing since June 6. What you see on the top portion of the screen there is our daily testing. The orange tips represent the positive test rate, and that's what you're seeing there. It's about 3.1% over the last week, and you can see that at the bottom. And so what does that mean? And just trying to put these numbers in perspective. If we're testing about 2,000 people each day, and that's what we're doing, a little bit over 2,000 people, that's about 60 positive tests per day. And so that's what we're trying to manage. Those are the numbers that we're trying to get down. And you can see in the left side of that screen, the left corner, since June 6th, we've conducted over 77,000 COVID-19 tests here in the city of Seattle. And that ties into also the work that we've done in our long-term care facilities and also our first responder testing. What you're going to see on the next slide is what Director Hayes talked about also, was the positive test rates that are happening in the young people. If you change the slide to the next one, you'll see in the bottom center of the screen there, back one, in the bottom center of the screen there, ages 25 to 29, those are where our highest number of positive test rates are coming from. So that's something that we're trying to pay attention to also. And then in the top left of the screen, you can see our overall results over the last 14 days and what we're seeing on the positive front. And then the heat map on the right really identifies where the positive tests are, positive COVID-19 tests are actually coming in around the city of Seattle. So It's really easy to get a test if you're experiencing any signs and symptoms of COVID-19. You can go to seattle.gov/COVID-19. You can register online. It's really easy to do. It's a really efficient process. Our process is really working well right now, so I do encourage you to do that. Now, what calls are we not seeing as much of since the pandemic started? And this is one of our concerns, as cardiac arrest events, stroke events, and severe respiratory distress. I do want to remind the community that our medics are the best in the world here, and if you're having a cardiac event, a stroke, or respiratory distress, or any type of event that requires medical care in the field, please call 911. We have been paying attention to this since the pandemic has started, and we know that these calls are not coming in. And well, what does that mean? That means more people are actually passing away in their homes because they're afraid to get infected in our medical care facilities or by our firefighters. Many of you see our firefighters on the street each day. When they show up on a medical emergency, they have their full mask and gowns and gloves and eye protection on. So we're making sure we're ready to take care of you. That's really important. So if you're having that medical emergency, please call 911. And then the final thing I want to touch on, as the mayor mentioned, is our Health One program. You know, I'm so proud of this program. It's been stood up since November of 2019. And the simplest way to put it on why we put this program into play is we're really trying to meet people where they are to get them the help that they need. And these are not those critical medical calls that people need help for. These are all of those other calls. Maybe a person is suffering from addiction issues or a mental health crisis or homeless or all these other things that we get called for each and every day. Our 2 firefighter EMTs and our caseworker, they respond to probably about 5 or 6 of these calls each day, and each call takes about an hour and 40 minutes from A to Z, and that's everything from the infield response to the follow-up care that's needed after to really serve people. We do things like we get people medical appointments at local clinics. If you need a place to sleep, we find a shelter with an open bed. If you need food, we find a way to get you food. If we're respond to you on the streets and your prescriptions aren't filled, we work out a plan to get that done also. And the aftercare for all these and other types of responses is critical. We have 4 social workers on staff here at the Seattle Fire Department that we do a lot of follow-up for every patient that we see in the field, because it's not just the response, it's really the aftercare that makes a difference, and that's important for us. So that's a brief about Health One and the great work that we're doing there. And I'll hand it back to you now, Andres.
Thank you, Chief. And then finally, Director Jason Johnson. Jason.
Andres, thank you. Good to be with you all. My name is Jason Johnson, Director of the City of Seattle's Human Services Department, or HSD. HSD's mission is to ensure individuals, families, communities are safe, healthy, and have their basic needs met. Racial equity is the guiding value as we conduct this critical work. And this evening, I wanted to provide 2 quick updates on behalf of the dedicated mission-driven employees of the Human Services Department. First, on the city's work to address homelessness. The city has created and continues to maintain safer shelter space throughout the COVID-19 pandemic. Since the COVID crisis started in late February, early March, we've created roughly 400 new beds to redistribute people from high-density congregate shelter settings to shelter beds at Seattle Center, at various different community centers, and through the use of hotels. The city opened 95 new spaces via tiny house villages and enhanced shelters in North Seattle and in the Central District. We did this in strong partnership with Public Health, with King County Department of Community and Human Services, and most importantly, in partnership with many community-based organizations. As a result, COVID-19 transmissions have been flat at city-supported shelter programs since implementing important programmatic changes. Even now, while we see increases in the general population. Robust testing is in place at shelters, hygiene centers, day centers, permanent supportive housing buildings, and other homeless service sites. We will continue to be monitoring the spread of COVID-19 and have isolation, quarantine, and recovery site capacity available if conditions change for our neighbors experiencing homelessness. Next slide. Given the conversations we're all having about community safety, I wanted to offer an update on some of the work the department is supporting. The Human Services Department invests over $18 million annually to promote family support, youth development, employment, and safety programs. We focus our services on community-based programs and projects that drive positive results for Black, Indigenous, Latinx, and other communities of color in Seattle. We can only do this because of the partnerships we have with community-based organizations, nonprofit agencies, and their leaders, with other city departments, and because of a strong commitment by HSD staff. In 2019, HSD released a safety RFP. Activities funded by this RFP focus on 18 to 24-year-olds harmed by the criminal legal system in Seattle. As a result of the RFP, along with other related contracts, HSD is investing over $6 million in safety this year. Some highlights from that safety investment portfolio are that HSD has committed $300,000 in 2020 toward a community critical incident response program to prevent and de-escalate potential incidences. In communication with Seattle Police Department regarding when and where critical incidences may occur, the designated community-based organization, in this case, Community Passageways, will immediately activate to hospitals and potential hotspots to calm tensions. They will also coordinate with community leaders who can regularly follow up with families of victims and perpetrators and leverage communities' knowledge about ongoing conflict. Community critical incident response priority population is youth and young adults who are gang involved, in the criminal legal system, or involved in incidences of community violence. Second is the Youth Consortium. The Youth Consortium is a program that introduces youth and young adults ages 15 to 25 to civic engagement. By investing in the Youth Consortium, HSD expects to prevent community crime by empowering youth and young adults to work together in a youth-led leadership program that reduces criminal legal system involvement through civic engagement and promotion of systems change for issues that matter to young people. 3 African American-led community-based organizations are contracted to lead this work: Create Justice, Rainier Beach Action Coalition, and Community Passageways. The next program I wanted to highlight is called Reentry, Rerouting Indigenous Community Healing. In partnership with the Seattle Office of Civil Rights, HSD is investing in 2 Native or Indigenous community-led organizations to provide Native-specific community healing practices for individuals re-entering community from prison. We've made $250,000 available starting this month and continuing through December 31st of 2022. One final update that I wanted to offer, the COVID pandemic and associated stay-at-home orders have been especially difficult on seniors across our city. HSD's Aging and Disability Services Division has been hard at work ensuring that in-home care services continue safely, that food and meals are available for delivery and pickup, and that there continues to be social engagements, though virtually. Please visit the HSD webpage for information about assistance for seniors and people living with disabilities. And I strongly encourage, I'll put this in the chat, I encourage folks to visit the age-friendly events page to learn about virtual events and activities taking place this summer. HSD is hard at work supporting the city's most vulnerable communities, especially critical during the COVID pandemic. We are available if you have any questions, and most importantly, available if you need help. Our website, www.seattle.gov/human services for more information. Thank you.
Thank you, Jason. We're going to go into the question and answer period of the agenda here. As a reminder, please enter your questions into the chat box feature. We also received hundreds of questions earlier through the registration process. As a note, this will also be recorded. It is being recorded and will be available on Seattle Channel in the next couple days. And if we don't get to your question, you can email jenny.durkan@seattle.gov. We will do our best to group these questions by themes. The first question, Mayor, for you and for maybe Chief Best is, what is being considered for moving activities and services currently performed by police, like crisis response or in other investigations, out of SPD in order to potentially reduce SPD funding? And how will the city ensure that these strategies are equitable and acceptable to communities of color in Seattle?
You're muted.
See, my chief helps me with everything. It's such a great question, and it's one that Chief Best and I and Chief Scoggins have spent a lot of time thinking about. And we really believe that we can reimagine policing in Seattle and can lead the way for the nation. We already know that there's lots of jobs that police officers do that really reflect where society is broken down, and that has been left to police. A great example is last year, Seattle Police Department responded to almost 17,000 crisis calls. Because of the great training we have and Chief Best's leadership and the resources that we have in the police department about crisis intervention and mental health professionals, we responded to those claims and those cases in a way that was a strong showing from where we'd done before. But the real question is there some way to address those calls and not have a police officer have to respond to those calls? It's one reason that led us to develop Health One, because we saw time and time again, people would call 911 because there was someone experiencing significant behavioral health issues downtown and seemed to be in distress or crisis, often someone experiencing homelessness. Our response traditionally as a city was when you call 911, they'd send a police officer there. Well, when a police officer came, they would have very limited choices to make. They could either arrest the person if they were committing a crime and take them to jail, which is never an effective mental health crisis intervention, or they could take someone to Harborview, which also seemed not to be effective. Now we have Health One, so that when we get those calls in the downtown corridor, and we're going to be expanding it to other parts of Seattle, a trained medic and a social worker go to the scene, and they can spend as much time as they need, as Chief Scoggins says, to see what that person needs. So I think we have to listen to community in all parts of the city so that we can build the capacity 24/7 so that if someone calls 911, we can get them the help they need. We don't have that capability right now. We need a plan, and we need to build up those resources in listening to community about what they need, but then having the capability so you really can have that response 24/7. So I think we will continue to have the need for police, and Chief Best can answer maybe in terms of the budget decisions we have to make going forward. But we know that one thing is going to be critical. In our city, if someone calls 911 and needs a police officer or a firefighter, they expect them to respond, and hopefully within 6 or 7 minutes, which is our response time for priority 1 calls. We don't want to have a system where when you call 911 and you have an emergency, those times and that response time increases. So staffing still has to be at a certain level so that at all hours in every part of the city, people get the help they need. So it's going to be a complicated process, but it's one that I think we really can show that we can have a different approach to policing and have a different approach to have really a public health harm reduction model to deal with so many cases that really don't need a police officer.
Great, thank you, Mayor. I think I can follow up just a little bit on that. First, again, thank you for all of your support, and Chief Scoggins, like you said, we are often having these discussions about public safety in general and how we might work together and how we might reimagine some of our public safety challenges throughout the city. Certainly there are areas where other systems that officers are filling in for example, at 2 a.m. When there's somebody in crisis, engaged in some activity, often that call comes to 911 and the officers really are the only ones available to respond. I myself have driven down on certain areas in 3rd and Yesler and up north, and really the only people I see out at that time are people who often need services and are vulnerable, and the cops. So it would be great, in my view, if there was another mechanism that could help us really reach out to these people who need services and need assistance. And I think we should be looking at all of those different avenues. But I also want to make sure that we're realistic about some of the things that can happen in the city, because not every night is going to be a calm night with non-criminal calls. Often there are very serious calls that officers are needed to respond to. So we want to make sure we have a healthy balance of whatever that looks like in the future. And that, as I said earlier, is community-led, that the community is a part of that conversation. I think all of us who live and work and reside and visit here want to make sure that we have public safety in every aspect of what we're doing, whether it's our children walking to school, when schools are finally open again, that is, or any other place. We want to make sure that there's an adequate level of staffing for those unpredictable and unprecedented events, as well as the appropriate level of staffing to handle some of our more routine issues, such as people in crisis or people who are struggling through addiction. So I think working together, we're going to come and find some real solutions to some of these really pervasive problems.
Can I just follow up on that, Andres? Because I think the chief raises a really good point that, you know, before COVID, and I had a series of town halls throughout Seattle with the chief often on public safety. And we know that before COVID, that there was some real concerns in parts of our city that when they called 911, either services were too slow or they didn't have enough police officers to really respond to what they needed. And so we do want to make sure that as we reimagine policing, we don't lose sight of the fact that there really are many events that you do need police to respond to. And you have other events where you need police together with somebody else who might have a different type of professional background. And so as we move forward in this, we have to keep sight of the fact that it is a complicated thing when you talk about community safety. But I think that we're the city who could get it right.
Mayor, I go to a question here from the chat. Mayor Durkan, my top concern for health and safety is our crisis of homelessness. How are you going to streamline all the different services to make housing, healthcare, and food security for everyone efficient? What dedicated social work staff will be recruited so the police do not have to, as you mentioned, respond to things like homelessness?
So I think that's a really great and timely question, because we are right in the midst of shifting our homeless services to a regional authority, because we know that the challenges related to homelessness, whether it is to prevent homelessness or to give services to people experiencing homelessness, don't stop at any city border. And in fact, you see an influx throughout the county of these same challenges. So we are right now, a regional authority has had 2 meetings. We're setting it up. The transfer of the Human Services Department staff relating to homelessness will be co-located to that new entity by the end of this year. We will continue to provide resources, but it is really a reimagining, again, using that word, of how we provide homelessness. We're right now in the process of putting together an implementation board that will bring together subject matter experts and the like to make sure that we really are delivering services in the most efficient way possible. And they are centered on the voices and experience of people with lived experience of homelessness. So it is really a new way to approach this, particularly that we have people with lived experience on all levels, the governing board as well as the implementation board, and also will be some of the service providers, so that we can really have a more holistic view. We will have to get upstream. We know why people become homeless. We know the systems that feed into homelessness. We spent a year really looking at the data there, and we need more help from the state and the county to make sure that they fund things like the mental health system, that they have a better system for people coming out of prisons and jails. Some nights before COVID, almost 10% of our largest shelter were people who literally just walked down the hill from either Harborview Hospital or the King County Jail because they were discharged with nowhere to go. So we have to get upstream, and we have to have a new system of delivery. And I think this new regional authority will help us get there.
Thank you, Mayor. I'm going to a question that we received in advance now, maybe for Chief Best. How will you ensure that protesters are safe and hold police officers using excessive force during protests accountable?
Thank you for that question. It's a great question. We get a lot of inquiry regarding protests and what happens in the city. And so we want to make sure that everyone has the ability to express their First Amendment right to free speech and to do so safely throughout the city. We get about over 300, that is, protests every year. We staff about 75 of those protests because of their size and potential volatility. And so we want to make sure that we are safely expediting people's free speech rights. And but that said, you know, often at times when we have groups that are intermingled with peaceful protesters who are not there for peaceful protests, that's when we have our most challenging time as an organization, because some people will come and they really don't have the intention of peacefully protesting, and they actually want to do direct destructive action or direct assaults. And that is when it becomes a challenge for those who've gathered to just really express themselves on an issue that's really important to them, whether it's, you know, Black Lives Matter or something else. And then there are others that come in and want to be disruptive. And we're really working hard to make sure that you know, we got a lot of feedback about using tear gas, for example, to disperse large groups. So we're looking at revisiting how we might be able to do those dispersals when it's needed, so that people who aren't engaged in criminal or obstructive behavior are affected. So these are really challenging questions that we're really looking at. We've asked a number of people to, you know, to help us with better resolution and tactics in that regard. When it comes to any issue of accountability or excessive force, you know, all of that is always reviewed, and complaints are handled through our Office of Police Accountability. And so any time that comes to our attention, we want to make sure if there's an allegation that is thoroughly investigated. We have some of the most stringent accountability processes in the country. I don't think people often recognize that, but we have a Office of Police Accountability, an Office of Inspector General, and a Community Police Commission, who are all the accountability partners who are independent from the police department, who review each and every allegation of misconduct, whether it's excessive force or anything else. And once it is reviewed and found to be sustained, then it comes to me if it actually did occur for review for disciplinary action if it's warranted. So I believe that we have one of the most robust systems in the country. I've been all over. I don't think there's any place that I can think of that has as much oversight as the city of Seattle. So you can feel confident that when an allegation is lodged against an officer, that it is going to be thoroughly and independently reviewed to see what happened and to make sure that we are operating within our policies and procedures and guidelines.
And Andres, I want to just add to what the chief said, because I think that really can't be stated too much. We have one of the most robust independent civilian oversight system for police department in the country. You also have a chief of police and a mayor who are constantly insisting that our officers follow policies and procedures. Every time we see events, often it will be the chief or the department itself that refers an incident to OPA or OIG to investigate. And we expect and know that those investigations will be thorough, including some coming out of the protests that we've seen since May. At the same time, I think the chief is right, we have had, since I've been mayor, hundreds of protests and marches, ranging from the Women's March that had, by some estimates, 250,000 people, to the Black Lives Matter March that had 60 to 80,000 people. Those proceeded with no incidents whatsoever. And even Saturday, we saw for hours the march proceed with no incident and police almost not present. It only changed when we saw enormous property destructions, arsons, and other destructive assaultive behavior. And then the police had to take the steps they needed to protect the people in the protest, as well as to prevent that action. I don't think we should lose sight of what the chief said at the beginning, because I will tell you, in all my years in Seattle, I have never seen a period of events when so many police officers are injured. And we cannot make that the new normal. We want to keep protesters safe, make it very clear. We want to make sure we protect protesters, we protect media, and we protect legal observers. But we also cannot have it where it becomes normal that so many officers get injured doing their job. That is not right and it's not fair. So we have to find a way moving forward that we do protect and value First Amendment rights. We are a nation that was born out of protest. It's part of who we are. But there's a difference between protesting and setting a fire. There's a difference between protesting and assaulting someone. And there's a difference between protesting and vandalizing a business. And that makes that job more difficult for the city to go forward.
Mayor, going to a question from the chat here. What steps is the city taking to keep untrained, unrestrained, and anonymous federal forces out of Seattle?
Thank you. And I think we have some good news on that front. So we learned about 3 weeks ago that the federal government was thinking of sending federal forces here. And at the time, the president indicated that would be military forces. Pete Holmes and I, the city attorney, objected in writing. We're prepared to go to court to stop them. It ended up not happening. Then the president said he was going to be sending federal forces in to tame and control the streets of cities in America, including Seattle. We've seen how that plays out in Portland, Oregon. Night after night after night, the federal authorities there have escalated the violence. We've seen, combat dressed officers arresting people and throwing them into unmarked vans. It's nothing I've ever seen before. I was a United States attorney and the chief federal law enforcement officer. It's not the way that federal law enforcement should be used. It's politicizing law enforcement, which should never be politicized. So when we heard that they were deploying federal forces, I talked to the acting secretary for the Department of Homeland Security, made it clear that we did not need or want that kind of presence here in Seattle. We saw what happened in Portland. He assured us that they had no plans to do that. He would call the chief or I if it changed. And then shortly thereafter, we learned that they had stationed a battalion here, I think a battalion, but a unit from Department of Homeland Security on standby to protect the court. Today, they confirmed for us that they have removed those agents from Seattle, which I think was the right thing to do. If I need assurance about public safety in the city of Seattle, I want it from Chief Carmen Best and not from Donald Trump. And I have confidence that she's going to do what we need to do. And so I'm hoping that this doesn't change, but the president still continues to make threats. And I've spoken with mayors across the country, including yesterday, to how we can join together to make sure that this doesn't happen. Because we need federal help. Let me be clear, our cities need federal help today. We need it so that unemployment benefits don't get cut off on August 1 and workers can't pay their rent. We need testing for COVID. We're still strapped on that front. Looking down the road, we know we're going to need things like PPE and isolation facilities. We need to make sure that our kids can learn if there's no school. That's the kind of help we need. We don't need division.
Thank you, Mayor. I'm going to go to a question that we received prior around COVID response. Eviction moratoriums are a good first step, but will the city continue to invest in rental assistance programs and other methods to get financial assistance and resources into the hands of Seattle's families?
Absolutely. We will continue our eviction moratorium. We've been talking to the governor to make sure that we stay aligned there, but we know it's too important as this crisis continues for people to lose their housing. We also are talking to the governor about providing some mortgage relief because we know that there's many families that depend upon the rental units they have for their own income, or they have to pay their own mortgages. We are working with both the state and looking at our own resources and talking to our federal partners as well as philanthropy and businesses to continue to build up the capability to give direct rental assistance to the people who need it. We know it's one of the greatest needs, as is food security. We put in place really quickly a food security program that I think Seattle can be very proud of. Everything from our seniors who were before going to our senior centers and they'd get a good meal there, suddenly they couldn't go to senior centers because they were closed. And we had to stand up a hot meal service to deliver to homes. We have a food box program, we have grocery vouchers, and we know it's still not enough. So we'll continue to do as much as we can and advocate at the federal level and the state level for them to step up as well.
Thank you. Maybe this question for Chief Scoggins, and then Mayor, if you want to add as well, from the chat. I understand that the Health One pilot program was inaugurated earlier this year. Is it still running with 3 people and operating limited hours? What sort of data collecting is in place to measure the program's efficacy? And how much will it cost, and how long will it take to grow the program to full citywide capacity?
Sure, thank you, Andreas. The Health One program is still running. It's running 4 days a week on 10-hour days, Monday through Thursday. Every now and again, we'll put it in service on a Friday, just depending on availability. We are collecting all types of data on all the runs that we go on, all the contacts that we make, the amount of time that we're spending, the resources that we're connecting with. We're really building this out right. We knew from the beginning that this program is scalable, as all things are, and that's what we have been having the discussions about. If there is an opportunity to scale it, we will, to expand the capacity. We have seen its effectiveness in meeting the needs of the community that we serve. I'll stop there.
And a follow-up to that, could the expansion of Health One be an option in, or be correlated into the conversation of, you know, removing or reforming SPD's budget?
Well, our goal is to meet people where they are to get them the services that they need. And if we expand the capacity of Health One, that's exactly what we would be doing. I believe that's what, you know, all of the conversations are about, is connecting with people, finding them the services that they need so they can be healthy and have a safe place. And that's what Health One is doing every day. So if we expand it, we fit right into that conversation.
Thanks, Chief. Mayor, a question that we received in advance, and I think we have maybe you for one more minute, and then we can offer some closing statements. If remote learning is the norm this fall, what childcare assistance and digital equity measures will the city institute? Mayor, you're on mute.
Sorry about that. I just met with the superintendent of Seattle Public Schools, Denise Juneau, together with folks from the Department of Education and Early Learning in Seattle. And we had a very good but very frank conversation. As mayor, and I know that Denise Juneau shares this, is we cannot afford for our kids to fall behind another year, particularly our kids of color. And we already knew that there was a huge opportunity gap between the performance of our white students and our students of color, particularly African American kids. We also know that it was those families who are disproportionately represented in the families that require free and reduced lunch, and that don't have as much access to computers and internet systems. And so we are working, and I asked her earlier this year to see what the school district could do to literally identify every kid in their system and determine whether they had access to the internet and they had a computer or device. And if not, how we as a city could partner with them to make sure that every student had access to the internet and had a device. But even that's not enough. We know that so many kids, you know, my kids outstrip my ability to help them in their schoolwork by about 7th grade. And kids need structure, they need tutoring, they need mentoring, and many kids just can't get that in an online environment. And so we're working with the school district to see if there's a way we can have additional centers that kids can get more help and more mentoring and more tutoring for. We're going to really focus on the kids of color, particularly the young Black male students, who this data is very clear are some of the least served in our programs. We want to make sure we pull out every stop, and I want to thank the people in North Seattle because you disproportionately voted in favor of our school education levy that gave us money to close the opportunity gap, that gave us money to make sure every kid in Seattle Public Schools could get 2 years free college. And we want to make sure that during this crisis and coming out of it, we don't forget how important that is. So every dollar of that levy is going to be put through the lens of how does it help make sure that our kids can learn this year. And also on childcare, we know it's a huge need because many families, they work. They don't work from home, they go to work. And they were counting on the schools that's where their kids would be. So we're going to work with the school district to stand up as much childcare as we can to serve those families so that they can continue to continue their jobs and get the supports they need.
Thank you, Mayor. I know that you have to run to another appointment, but do you want to offer any other closing thoughts?
I want to say first, I know this was too short and there was many questions that people didn't get to ask. Send them, we'll try to answer them, and we're going to try to get more of these on the books. I think during this time, it's just enormously challenging. If you take the COVID crisis, the economic crisis, our civil rights reckoning, and a really difficult political framework in our country right now. It is hard on almost everyone in Seattle. It's going to be hard getting through this. I think we will get through it. We will come back strong, but there's some tough days ahead of us, and we've got some really important, tough work to do. We have to reimagine policing, but we have to do it in a framework where we also make sure that we continue to protect public and community safety. We have to really dismantle generations of systemic inequities and systemic racism. But no one mayor, no one police chief, no one city is going to do that immediately and overnight. It's going to take all of us working together, willing to listen to one another, willing to take steps together. We have got to show that unlike the national framework, if we come together and are willing to have some tough conversations, but willing to roll up our sleeves together, we can get things done. If all we do is devolve into division, we are no better than the other Washington. And I think we are better than the other Washington. So I know it's a hard time. You have my commitment as mayor. Every day I get up thinking about how do I do my job in a way that makes it better for everybody in Seattle. And that will continue to be my commitment to you as long as I'm mayor. So thank you for all you're doing. Thanks for taking this time. And do try to get some enjoyment out of this weather, because all winter long we complain about the rain and the dark and the cold. And this is what we're waiting for. Take care, everybody.
Thank you, Mayor. As you noted here, this conversation is being recorded and it will be available on Seattle Channel in the coming days. I know that not all questions were addressed, so if you have a specific question, you can please email jenny.durkan@seattle.gov. Again, a reminder for COVID-19 information, www.seattle.gov/mayor/COVID-19. And to get more information about community safety and rethinking policing, www.seattle.gov/mayor/rethinking-policing. As the city continues these conversations on COVID-19, on economic recovery, and on police reform, we also welcome the opportunity to meet with any community group to discuss these issues. So if you're interested in that conversation, please again email jenny.durkan@seattle.gov. Thank you again and good evening.